Okay, welcome everyone. Thank you for joining us on the webinar. So the purpose of this webinar is to roll out the Depression and Bipolar Support Alliance's newest grassroots advocacy campaign. So for many people, being empowered is an important tool in their wellness plan. This is often the case when people are newly diagnosed. After being silent for so long, they're looking for a constructive way to make their voice heard. And just as important, for many people who have experienced a difficult journey on their path to wellness, they want to make sure others have an opportunity to find a softer landing. Recognizing that stigma and public policies might be barriers, these people want to make systemic and institutional changes to the way society views and treats mental health conditions. The DBSA national organization supports these efforts by offering a program that is focused on advocacy. The DBSA advocacy programs mirror the organization as a whole core objectives to create a world that targets the whole health of the individual, not just the mitigation of this week's mood disorder episode. We've identified key areas where we can both make the greatest impact in creating that world and also have DBSA participants be partners in creating that world. The guiding principles around our advocacy are to increase access to quality mental health care that uses evidence-based treatment models and eliminates barriers that can keep people from leading the lives they want. One way to ensure that is through the implementation of mental health parity laws. And those are the laws which state that your health insurance company must provide the same level of benefits for mental health conditions as they do for medical and surgical benefits. Another prong in our advocacy is promoting peer support as an evidence-based model of care and creating an environment for the development of the peer support specialist workforce. And the third objective in our advocacy work is to include the perspective of the peer, not only in individual treatment planning, but also in research and development of new treatment options. So the current environment that we're looking at is due to uncertainty at the federal level around Medicaid reform. States are under increasing pressure to reduce their mental health care Medicaid spending. The mental health parity law requires state legislation to realize its full implementation. And DBSA has community engagement staff in 3 key states, Illinois, California, and Ohio, to mobilize the voice of the lived experience. So this creates an opportunity for us to ensure that the voice of the peer is an influencer on state-level policy-making decisions, and also to empower evangelistic advocates through a DBSA program. Evangelistic advocates are advocates that want to spread the word far and wide. And then it also creates an opportunity for us to increase the value of the DBSA national organization to the affiliate chapters. And how are we going to do that? We're going to identify those evangelistic advocates, and then we're going to identify tools and networks for staying informed on personal storytelling opportunities. We're going to train those evangelistic advocates to provide written and oral legislative and regulatory testimony and interviews to reputable media sources. And we're going to track all of this by building a database of those evangelistic advocates so that we can keep them engaged and readily mobilize them. The ultimate initiative of the grassroots organization is to raise the voice of the individual with lived experience. DBSA is uniquely positioned to offer that perspective, and we believe that when we do, it will strengthen the pillars of our approach to whole health. The primary strategy to accomplish that is to develop a panel of evangelistic advocates, those individuals who would like to share their experiences publicly to affect change. We'll provide guidance in developing with personal meaning and a clear call to action. Some GO members may want to share their story, some may not. But everyone involved with a GO can identify others who want to share their story. And when we do that, when we develop a panel of 5 storytellers in each of the states where we have a GO, they'll be able to meet with their legislators and attend legislative hearings, regulatory hearings, and provide interviews, as I mentioned, with reputable media sources. We're hoping to begin that process, have at least one person who would be willing to share their story at the beginning of 2019. We're going to identify those people, meet with them, train them to tell their stories so that they can go on and influence that policy. So first we have the individuals with the lived experience. Those people have stories about how public policy affects them. And they're also affected by the way they're portrayed in the media. And everyone with a lived experience is a potential advocate to get involved at some level, and whether that just be responding to action alerts or becoming a volunteer in a grassroots organization at the state level. The media is responsible for raising awareness about the effects of policies on people with lived experience, and they also portray the narrative that influences that public policy. And finally, in public opinion, everyone out there is someone who votes, a potential advocate, and when necessary, someone who could demonstrate. The DBSA is seeking to identify peers who have a natural gift and desire to be a catalyst for change through storytelling. And we're doing that through chapter outreach, DBSA GO activities, which include advocacy workshops, mental health fairs, advocacy platform, and our social media and our monthly newsletter. Those efforts will produce a database of evangelistic advocates that we can mobilize. We empower those people we've identified to share their story with their legislators and the broader community by connecting them to opportunities to provide legislative testimony and hearings, and also to provide interviews with reputable media sources. This network allows us to disseminate personal stories that illustrate targeted messaging of DBSA's key issues. So once we've identified those storytellers and the opportunities for them to share their stories, we'll meet with the storytellers to help them develop testimonial that highlights DBSA's key issues as told through their personal experience. We ask them storytelling development questions to assist with flow and succinctness. As a result, we'll have a bench of advocates who are primed to be mobilized when there's an opportunity to share their lived experience. And as an organization, we will track, compile, and update a listing of contact information, a brief synopsis of the story of the evangelical advocate for reference, rapid mobilization. Whether we're called upon to provide legislative testimony or an interview, we'll have someone primed and ready to go to share their story, and they'll be trained so that they can share their ask effectively. And as a part of that, that includes everyone in the Go. When you meet somebody and you have an opportunity to pitch to them being an evangelistic advocate, if you record their name, their contact information, could even just be their email or just their phone number, and just a little bit of what that story is about, that helps the community engagement staff to follow up with them and ask those questions. That brings us to the end of our presentation. Thank you for bearing with me, and I'd like to open it up now if there's any questions that anybody has. This is, of our many initiatives that we have at the Go, this is one of them, and arguably our overarching one. So when we have a mental health parity presentation or an I'm Here presentation, anytime we have contact with anybody, we're always looking for somebody who'd be willing to share their story.
Okay, so from the point of view of being a California Go team member, the organizational liaison would be with Paul and Phyllis? That's the question.
Yes. So
okay.
When you make contact with somebody as a Go volunteer, and it seems like that would be a good person who would want to share their story, then if you could collect their contact information and just a very brief synopsis of, this person believes they have a parity issue, or this person was subjected to step therapy by their insurance company, and pass that along to Paul, who would then follow up with that person and begin that process of helping them develop their story to tell their effective.
And the spokesperson might or might not be a member of the Go team in terms of other responsibilities, right?
Yes. In terms of other responsibilities, they may not have any. By being a member of our panel, they will de facto be a member of the Go.
Yeah, this is Eric. Are you only looking to recruit people from the 3 states? That's A. And B, I noticed you didn't make any mention of the federal, advocacy work we do, and whether you want people who can be, storytellers for federal issues.
So at this point, we're looking to find a panel of 5 people in each of our 3 states, as well as we'd like to expand into 2 more states, one probably Texas, and then the other one to be determined. And our issues are mental health parity and access to medication. And so those people could be called upon to also provide testimony at the federal level. But those are our primary issues, and then once we've developed our panel, our bench, on those issues, a robust panel surrounding those issues, then we would look at taking on another issue. This is designed to be a scalable program that once we know what we're doing and can effectively train somebody to tell their story and make the legislative ask attached to it, then we can scale that to whatever our legislative issue is. Hopefully this has outlined some of the responsibilities and roles for the community engagement staff and Go volunteers, and we will continue this initiative and continue to keep moving forward on this.